Welcome back into the Rock Pod from the Royal Oak Chamber of Commerce. I am John Gay from Jag and Detroit Podcasts.
I am Lisa Bibby with Keller Williams Advantage.
I am Andrea Arndt, an attorney at Dickinson Wright.
And I'm Trish Carew, third-generation jeweler and owner of Your Personal Jeweler.
Today we have with us Denise Brooks-Williams, Senior VP and CEO of North Market Henry Ford Health System. Denise, it's great to have you with us today.
Glad to be here, John.
So Henry Ford has had a presence in Royal Oak for a number of years, offering primary care. It's now opening a new state-of-the-art medical center this summer. It's going to be moving from Woodward, just south of 11 Mile and east of Maine. But before we get to that, we want to hear a little bit about you and your background.
Absolutely. So I have been with Henry Ford Health System now for 8 years. I'm a lifelong native Detroiter, always been in healthcare. My current role with Henry Ford is responsibility for what we call our North Market, which geographically is Oakland and Macomb County. So it absolutely includes Royal Oak. I'm super excited about the opportunity that we have to broaden our commitment in the community. And it really does fit with Henry Ford to be able to bring additional services to the area.
Well, that sounds great, Denise. Can you tell us a little more about the Henry Ford Health System in general?
Yes, Andrea, I can. So Henry Ford Health System is over 100 years of providing community care to the greater Detroit area. We have 5 acute care hospitals, 1 behavioral health hospital, 30 medical centers, and those will be our large access points similar to what we will have in the Royal Oak community. We also have a health plan, Health Alliance plan, which I'm assuming some of the listeners are familiar with. And then we have all of the other services that round out care to the community. We have retail eye sites, which we'll have one of those in the new Royal Oak facility. We also have home care, and we have lots of community outreach programs that we have, school-based health, clinics, so lots of services that we provide throughout the really greater Detroit area, but also we're in Jackson, Michigan as well now.
I heard you just mention the new facility. Can you tell us a little bit more about what will be different from the new facility from your existing location?
Yes, Trish. So one is just the scope and size. As we said, our current site is primarily primary care. The new site will have specialty services that will be provided there. We'll also have a walk-in clinic, and our walk-in clinics are a great asset to the community, which allows 7 days a week access for care that they may not anticipate and make an appointment for, things that are on demand. We also will have surgical services there, so we'll have 2 ORs as well as several procedure rooms. So a very comprehensive site. It's a 140,000 square foot facility, so significantly more specialty services and procedural services that will be able to be offered in the community.
Well, Denise, this sounds so exciting. We've got a question for you here. Is Henry Ford hiring new staff for the medical center? And if so, what is the best way for someone to apply?
Lisa, yes, we absolutely will have new staff, and they could really go to henryford.com, which would allow them to be able to navigate to employment, and postings for the Royal Oak Medical Center would be there. We would love to have people apply if they have skills related to healthcare.
Well, that sounds wonderful. Can you tell me a little bit about the park out front of the new medical center?
Yes, Andrea, we're so excited about that. So as you know, as we come into the community, it's really creating an opportunity to create the park and the green space that'll be just adjacent to the health center. And so we're looking forward to being able to partner with the city and the chamber, hopefully, on events and activities for both our staff and our patients, as well as the broader community. So our vision would be things like yoga in the park in the summer, being able maybe to have concerts and creating just an environment of healing as well as fun. So we're super excited to be able to be a partner to the beautiful space that will be there.
I'm wondering, do you have an opening date for the new medical center yet?
Well, John, we are hoping that it'll be sometime in the summer. Our target right now is mid-July.
So, Denise, how will having this medical center in the heart of Royal Oak help its residents?
Well, Lisa, I think that's a great question. And so we're excited because we've been in Royal Oak, as we said, for a number of years. But we know that this new site will offer convenience. It creates more of a one-stop shop opportunity, as I said, because of the expansive services that are there. So currently now, as an example, if we were referring someone for specialty care from our existing site on Woodward, they may have to go out of the community to receive that care. In this new location, they'll have many more services that are close to home, as well as even surgical services opportunities that are right there for outpatient surgery. So definitely convenience, one-stop shopping. And as I mentioned a little bit, this concept of having walk-in care that will be close and in the community.
Does Henry Ford have opportunities for people to volunteer? And if so, what type of volunteer opportunities do you guys have?
It's a great question, Trish. We definitely count on volunteers to be able to deliver our care. My last visit to the Royal Oak Medical Center, we talked about volunteers being able to support us with greeting our guests as they come in, helping them to wayfind in the building. And sometimes our volunteers are just companions. As someone is waiting for their loved one in a surgical procedure, just being able to offer them coffee or being able to support them with magazines or just knowing where to find things in the building. So we definitely look forward to having volunteer opportunities on site.
Oh, that sounds great. When I was in college, I volunteered at the local hospital near my college and also in London when I studied abroad. Some of the opportunities was transporting patients from one area to another. And I still think hospitals are very confusing, but it did help. But it was interesting to volunteer at different hospitals to see how they're run and, some of the similarities, but each hospital is just so different. So it's great to have this new and exciting center in our community. So thank you for all your hard work and bringing it here.
Absolutely, Andrew. I would agree that hospitals and health centers, right, have their own culture and climate, and we're looking forward to the Royal Oak Medical Center adding that to the community. And it will be its own special place, and we hope that the park creates an opportunity for people to enjoy.
So Denise, I was super excited to hear that you guys are going to be a part of the park and adding other aspects of health like yoga and music. So I love seeing this change. What do you think kind of spawned Henry Ford to be a part of this change in your overall health, not just your physical and surgical health?
Great question, Lisa. I think that Henry Ford Health System, like many of our other health partners in the community, we really only want to be there when people need us. And so a lot of our work and efforts are around prevention and screening and really the whole concept of being healthy. But we understand that sometimes we're not. And so we have a need for medical services. So we're there for that as well. But it's always a part of our, agenda, I guess I would say, in outreach to promote a healthy community. So really it's not new, just a new way that we can do it in the Royal Oak community.
Denise, I'm curious, you mentioned at the top growing up in Detroit and being a lifelong Michigander. I'm curious what drew you into the medical field and got you involved with Henry Ford, if there was anything that happened that spurred that interest for you or how you got into this whole thing overall.
I would definitely say forever, right? So from a child, I loved math and science and maybe a little geeky in that sense.
Nothing wrong with that.
When I was in college, I considered some clinical paths and decided not to do that. One, I didn't like blood, all the classic things that you hear, right? Didn't like blood. I thought I was going to be a pediatrician. Didn't necessarily like sick kids. But I stumbled actually into the idea of hospital administration at the time and went to school of public health straight from undergrad. And I've never looked back. So I've always been in the healthcare space and largely wanting to help people and be able to have impact in the communities. The last part of your question was around why Henry Ford. Henry Ford has had a long, over 100-year commitment to the city of Detroit, very invested in diversity, equity, and inclusion and making an impact in all of the communities that we serve. So it was clearly a dream opportunity to be able to join Henry Ford Health System. So I consider it really one of the premier institutions in the country. So super proud and excited to be able to be a part of the team.
So we love our fellow geeks, and I love that you're a geek as well. Can you tell us what is the geekiest thing that you're into?
Oh, wow, Lisa. My geekiest thing. So here's the funny thing, right? When people ask me about hobbies, I really don't have any. The pandemic took away my fun, which was travel, right? So I would have said that. I don't know if that's, a geeky thing. But I would definitely say from a tech perspective, albeit not the start of our conversation, I tend to be the person in my house that can solve the tech issues. So always playing with devices, always figuring out, I've learned now how to screen share church for us on Sunday because it's virtual church for us, but getting it up on the big screen. Now, sometimes I get stuck and it stays there, but playing with technology maybe not the geekiest thing, but for me it is, because I would not consider myself the techie person.
Denise, you mentioned the pandemic a moment ago. I'm wondering if you have any thoughts you want to share about the staff at Henry Ford and the efforts, Herculean efforts that they have made over the last year plus. I mean, we're recording this on April 29th. This is going to be released a little bit later on in the summer. So things may change, of course, with numbers and stats and things like that. But wondering if you have any thoughts to share about the team that you work with over there at Henry Ford over this past year plus.
Absolutely, John. I would say gratitude, just awe-inspiring to see what our team has done. As you know, and we all know, right, being in Michigan, we faced the COVID-19 pandemic head-on in 2020. And for our team, unfortunately, it really has not relented, right? We're in yet another wave. Even as we speak today, we have over 300 people that are within our hospitals, our respective hospitals. That's down, thank goodness, from 500 at the beginning of this most current wave that we're dealing with. But I just see such resiliency amongst our team and my colleagues. And so when I think of what they've done, it is definitely Herculean, definitely selfless, the risk that they've taken to take care of our community. And so I just have gratitude, sincere gratitude. And whenever I'm able to round and thank people that have been a part of this battle, that's what I do. So I think our team is absolutely amazing.
You can't say that enough, and thank the healthcare workers for just the efforts they've made over the last year. We absolutely can't say that enough. And I'm sure coming from hospital administration, knowing that gratitude that you and your team have, it really goes a long way just to thank them for the tireless efforts they've put in.
Absolutely. The community makes a huge difference as well. So I'm sure that each of you in your endeavors have, expressed your gratitude. And our teams have felt that, right? Our communities have been such a great inspiration to the work that's been done. We've had parades, we've had donations of food, just tremendous support and outpouring from the community.
Is there anything more that we could do to help the staff who are working at the hospital?
Andrea, I think that just keeping them lifted in the sense of even John's question, just asking, how are they and what they're doing. So I think whatever industry you're in, just remembering that when we hear those data and statistics on television, that there's someone's, right, mom, dad, brother, cousin, friend, that is within the four walls of our hospitals caring for the people that are suffering, from the consequences of the virus. And they do it heroically without a name and a face a lot of times. There's been some opportunities to, maybe one thing is have someone on your podcast who is a member of a team to talk about their journey and their experience with COVID. I mean, we have some nursing units that consistently have been the high volume units that have cared for those patients, but you just would be in awe to see the love that they have for those families and how they found a way to connect and speak with one about their loved ones, cheer people on. Happiest day for us is when someone goes home to be back with their loved ones and they regain their health. So it really is an awe-inspiring thing to see. So I think wonderful question, but just keeping them in your mind and your thoughts and your prayers, I think is wonderful. And if ever you have an opportunity to celebrate a healthcare worker, do so.
Denise, I moved my business to Royal Oak in 2019, and I absolutely love it in Royal Oak. Can you share with me some of your favorite activities to do in Royal Oak?
Oh my, yes, I can, Trish. So the funny thing for our team is when we went to do the beam placement, I would tell people I go to Royal Oak all the time. I go to Royal Oak all the time. And they're like, oh, sure. So literally I get my nails done at Studio Nails and my nail technician came outside. Michelle was like, oh my gosh, Denise, you're here for the Henry Ford event. So I get my nails done. My family also dines in Royal Oak frequently. Our favorite used to be Town Tavern, but now they've closed. But we dine all the time. And we used to go to the movies all the time, right? When movies were a little bit more popular pre-COVID. We have not been, but we look forward to being able to go back to the Royal Oak Imagine Theater. So lots of things, very close to my home. I still live in the city of Detroit, but I'm at Woodward and 8 Mile. So I'm in Royal Oak all the time. I shop at Holiday Market. That's my market. So I do lots of things in Royal Oak.
Love Holiday Market. They provided our wedding cake 3 years ago, or 4 years ago now. And when you buy it there, you get the free anniversary cake on the 1-year anniversary, so you don't have to eat frozen cake out of your freezer a year later. So shout out to the bakery at Holiday Market.
Oh, absolutely. I just placed an order. I have my youngest daughter's graduating from the University of Michigan this weekend. And so I was just at Holiday a couple days ago ordering maize and blue cupcakes.
Nice.
Thank you.
That's fantastic. Congrats to her.
Thank you.
And now it's time for our fishbowl question of the day, where we pull a totally random question for you. Trish, can you pull the fishbowl question of the day?
Absolutely, Andrea. Let's see what it is. Denise, we have for you, what is your fondest childhood memory?
Oh, wow. Okay, my fondest childhood memory would be on my 5th birthday when my brother was born, because we're born on the same day.
Oh, wow.
Wow.
Just 5 years apart, June 12th. Yep, same day. Best birthday present ever, right? I asked for a television at 5, but I got the television and I got a brother.
Sounds like the brother's pure entertainment, much more than a TV could be.
Oh my gosh, Lisa, that is what it has turned out to be. Yes.
I had my first son at 11:59 p.m., 30 seconds before my birthday.
Oh my
gosh.
You have a 2-day celebration every year, right, Trish?
Yep.
That's always amazing to me, right? People think we're making it up. I'm like, no, literally, we're first, second kids, same day.
Expensive day for your parents. It's kind of like, it's like having a second Christmas, right?
Yes, it's like merging the birthday parties was fun.
Well, at least it's 6 months after Christmas, so they get a little break.
This is true. Being in the summer is a good thing. Yes.
Do you guys still celebrate your birthdays together?
We do. We still
nice.
have a family dinner where it's our birthday celebrated together.
Well, Denise Brooks-Williams, Senior VP and CEO of the North Market Henry Ford Health System, we really appreciate you joining us on the Rock Pod today. If people want to know more about the facility, where can they go?
They can go to henryford.com and put in Royal Oak new location, and that will allow them to know more about the services that we'll offer, and they'll be able to watch and see when we open this summer.
Well, it's so exciting. We are waiting your opening. And my name here is Lisa Bibby, and I'm a realtor with Keller Williams Advantage. I put the real back in realtor. Curious about getting top dollar for your house? Find out your options if you're looking to sell and buy a home at the same time. You can find me on Facebook, LinkedIn, YouTube, and Instagram at Sold by Lisa B.
I'm John Gay from Jagged Detroit Podcasts. I believe nobody can tell your story better than you can. So for help creating a podcast or improving your existing podcast, you can find me at jagindetroit.com or on social media at jagindetroit.
My name is Andrea Arndt. I am an intellectual property attorney at Dickinson Wright, and I help my clients protect their inventions and build their brands. You can find me on LinkedIn and on our website, dickinsonwright.com.
I'm Trish Caruth, third-generation jeweler and owner of Your Personal Jeweler. I specialize in creating custom engagement and wedding rings and fine jewelry. You can find me on Instagram and Facebook at The Personal Jeweler or on our website, www.thepersonaljeweler.com.
Thanks again for checking out this edition of The Rock Pod presented by the Royal Oak Chamber of Commerce. You can follow our podcast on Apple, Spotify, or wherever you get your podcasts. And for more information on the Royal Oak Chamber of Commerce, go to royaloakchamber.com. Thanks, everyone.